If a child got several ear infections and they refer you to an ENT doctor, and the doctor refers to this as a chronic middle ear effusion, what does that mean?
A chronic middle ear effusion is a fluid effusion in the middle ear space behind the eardrum, which can prevent a conduction of the sound to the cochlea, which is the hearing organ. So what happens is oftentimes an infection will be treated with an antibiotic. The infection resolves, however the fluid remains. When that happens, it can block the sound and cause a conductive hearing loss in the child. And at times that fluid will last for 3 to 4 months. And if a child has a conductive hearing loss for 3 to 4 months and is having difficulty hearing, oftentimes we will entertain the idea of ear tubes. And that's one of the indications.
Well, if a kid can't hear correctly, he's like a distant sound, or sounds muffled,
distorted.
Okay, it could affect the kid's language development to some degree.
Sure could. In fact, that's one of the concerns around the time that kids begin language development. Around that 1 year old age group, it's very crucial to have normal hearing to help develop speech and language. So oftentimes children will develop a speech delay, and it could be due to a hearing loss. So if there are chronic ear problems, ear effusions, ear infections, it may be worthwhile having the child evaluated for hearing issues in order to resolve the delay in speech.
That's why if any kid has hearing loss, we do a tympanogram to make sure there's any fluid.
Correct.
We also get the kid evaluated with a good hearing test. That newborn hearing test, which is done in our state, is a screening test. It's not a definitive test, so many times it could be normal. Later on you do it, it wasn't normal.
Correct.
At the kid a year of age.
Depending on the state and the country you're viewing from, there are 2 types of newborn hearing screenings. There's an otoacoustic emissions, OAE, and there's an ABR, auditory brainstem response. And depending on the state you're in, they do different types of tests. You'd want to ask the ENT physician or the audiologist who's doing the test what they're performing to better understand what an abnormal test means.